Okay, so at 1:01, we'll get started and make sure any stragglers get into the meeting.
Hi, this is April Carver. I'm trying to get on my laptop, but it's not taking the code for the meeting.
Okay, I mean, did you go out of Teams and try to go back in again?
No, let me try to do that because I know whenever I'm on my phone and my phone rings, it throws me out of meetings. So I'm still
Yeah.
trying to get in. Hold on one second.
Okay.
Another common issue is if you have a different Teams account from different email address, sometimes it logs you in automatically under your non-school email address.
Yeah.
And that may be an issue. Try logging in under your school one.
It looks like I have the same issues too because the
Oh, there it is. Okay. All right, give me one second. I'll do this. Okay.
I posted the link in the chat too.
Okay, yeah, that was what I was about to do. Okay.
How many are we expecting today, Paul?
I do not know exactly. I would have to talk to Kathy. She probably knows better than I do.
Chase, can you see me? I feel like
I
everybody's
can see you, Kayla.
Okay, is it a little grainy or no? It's clear.
It's a little grainy, but I wonder if it's just because sunshine directly in your face.
No, because
Maybe it's
everybody
just like
else
super
looks
bright.
everyone else looks grainy to me too. I might have to just log into my laptop. We'll see.
Okay, it may just be the connection for the day.
Okay. All right, we're going to get started here. You can have your camera. We prefer that your cameras are on, but if they're off, okay, if you're shy or you haven't got ready for the day, I can understand that. It is just one, and there are a lot of people work nights, so I can understand that. Okay, so anyways, my name is Paul Frazier. I am the nursing program manager. I work directly for the director of nursing, Dr. Pamela Frost. I think we'll probably hear from her a little bit later on. So anyways, this is a nursing orientation for IM. I know it says AIAM, but we usually pronounce it IM. Okay, let's get this first thing here. Okay, so program directors and coordinators, like I mentioned, Dr. Frost, she's the director of nursing. That's me, the
Paul, would
nursing
you
program.
mind sharing your screen, please?
Yeah, no,
Your
I wouldn't
screen
mind. I
sharing.
wouldn't mind at all.
That might be helpful.
It is helpful. Okay, there we go. All right, so here we go. Program directors and coordinators. Like I mentioned, Dr. Frost. Myself as a nursing program manager. Chase, you'll see she's on there. She is our clinical coordinator and handles our medical documents and does a whole lot of stuff. Dr. Gould, he will probably not be in this meeting. He's the director of education. You would have seen him yesterday in the initial briefing. And then Kayla is our lab coordinator, lab manager, jack of all trades, lab person. You will see a lot of her, whether you want to or not.
You'll see me all the time.
Yeah. Okay. So we kind of go in the philosophy of holistic nursing, and it's kind of an approach that is the whole person approach, mind, body, spirit. We don't just look at the body, we look at the mind, the body, and the spirit, because it includes the physiological, psychological, social, cultural, developmental, and spiritual domains. I mean, we consider culture. There's a lot of things that we consider whenever we put our program together. And when we teach our programs, we try to include a lot of different things. We understand we have quite a diverse student body. Okay. And it's not so much about what a nurse does, but how he or she does it. And then, of course, holistic nursing practice promotes healing energy. Okay, so what you'll learn all nursing skills that are appropriate to your scope of practice. You'll have a holistic nursing class, so you'll learn professionalism. You also earn the IV therapy certification. Okay. Okay, so the program details the practical nursing program. Okay, it's 48 instructional weeks or 12 months. You have 4 quarters, obviously 3 months per quarter. It's a total of 821 contact hours and 50.5 credit hours. The last classes that you take are transition courses, and you have to pass the HESI predictor test with at least a score of 900 on the exit exam to complete the program. And you have multiple attempts at it. It's not just one time. You do have multiple attempts. Okay. Chase, do you want to talk about these?
Yes. Okay, let's talk about some clinical requirements. While you guys are with our program, we're going to be able to get you 100+ clinical hands-on hours, I believe, Paul, with our 12-month. I think it's 104 clinical hours total.
Yeah, much more
so
than in the
part of our
past.
requirements. Yes, we're really excited about it because this is where you learn how to be nurses, right? The classroom's great, but we like the hands-on experience as well. So what we require from you guys are the same things that are expected once you're in the actual nursing field. So what we'll have you send us is background check and a negative drug screen. Both of those are done through ARC Point Labs. AIM does cover the cost of it. I will send out more information regarding that, so that way you guys don't have to guess how to find it and all of that. You're going to need to do a physical health exam, 2-step TB. If for some reason you have a positive TB test, then you're going to need a chest x-ray to show that you are negative for TB. It's really important for your health as well. TB is a very vicious disease process. You're going to need a flu vaccine if you are doing clinicals from March, the October through March time period. So every year that needs renewed if you're doing fall clinicals. And then we have a couple different vaccinations that we need information from: Hep B, Tdap, varicella, MMR. Again, I have a checklist for you guys. I'll send it. It makes it a lot easier so you don't have to try to remember all of this today. And you will also need to do BLS through American Heart Association. That is one of the few that we recognize. Good, Paul. I apologize also, I'm 38 weeks pregnant, so little guy's up on my lungs and I get out of breath really easy when I start going on these rants. So continuing. Thank you very much. I appreciate that. We're going to make it. All my mamas out there, you guys know when we hit this point, kicking our booties. All of these clinical requirements, except for the background check and the drug screen and the nursing physical health form, are due the first day of second quarter. So you have time to get me all of this information. I have a course called Great Starts that you'll be taking. During Great Starts, you can upload your documents as you go through. And then I can tell, I think Paul's frozen. Am I frozen? Can you guys hear me okay?
You're not frozen.
Okay, perfect. Just double checking that I'm not ranting. So you're going to get me background check and drug screen, and then that nursing physical health form ASAP. All the rest is due second quarter, first day of second quarter. You cannot go to clinicals if you do not get me this information. And then, of course, if you do not get me this information and can't go to clinical, then that is a failure of clinical. And we hopefully don't have to go down that rabbit hole. We're going to try to avoid that. Okay.
I can talk about this real quick. Okay, so the drug screen must be completed, must be negative for prohibited drugs. Notice I say prohibited unless medical documentation or a note from a medical provider for prescription medications provided. Okay, marijuana is not a prohibited drug, but I will say you can't smoke, take a gummy, whatever with THC and show up for class or clinical. It's just like drinking. Drinking alcohol, same thing. Okay, if you have been, and this has happened in the past, if you have been partaking, remember marijuana is legal. And if there's something on your test and it's marijuana, as long as it's not something crazy high, we understand that. We're good with that. But do not try to use fake urine. They have different ways over at our testing facility that they can check it to see if it's actually real urine, because a lot of people try to, because you can actually order it on the internet, but it doesn't work. At least not here, not with our lab. Okay, and like I said before, you can't be under the influence of any substance, legal or illegal, including alcohol or marijuana during any school activities. If you appear to be impaired, we will send you for testing. Then, of course, if you refuse to test, we're going to consider it as a positive result. Okay, go ahead. I'm sorry. Chase, if you want to do it.
You're absolutely okay. COVID-19, we're a couple years past that, obviously. So we have a little bit more wiggle room instead of requiring you straight up to the COVID-19 vaccine. You can do a declination, if I'm saying that correctly, form to where you're opting not to receive the vaccine. And then if you happen to have already gotten your COVID-19 vaccine, you can just send it our way as well. If you choose to decline, you will likely have to wear a mask at a lot of facilities with our patients being very high risk. They're going to want to try to be extra protective. COVID is starting to show it's like our flu, where it's going to happen every year. And we have our peaks and valleys, and these winter seasons happen to be our peaks. So just better safe than sorry. It protects you as well from anyone else who may try to accidentally give it to you. Same thing with our flu vaccine. It is required. And if for some reason you've had an allergic reaction before, please get us a exemption paperwork. We want to work with you. I don't want anybody having allergic reactions to anything. That would be tragic. If you have questions regarding any medical documents, clinical, anything, you can email me. It's my first initial last name at aim.edu. I will send you reminder emails during the quarter as well. You'll be sick of seeing my name. I'm so sorry in advance. A lot of them are just kind of scheduled. So if you're communicating with me, I can stop bugging you. That would be great for everybody.
Okay, so I can
Okay.
take over this slide. Like Paul said, my name is Miss Kayla Chapman. I usually just go by Miss Kayla, and I'm the jack of all trades. So one thing that I do cover is open lab. So while you guys are in your lab courses, you will have certain checkoff skills, and you will need to be successful in your checkoff skills. You get 2 attempts. So though you are able to practice those skills during lab, sometimes we do need extra lab practice. So that's where open lab comes in. We have a variety of hours that we're working on setting for you guys. And but it is necessary to successfully complete your skill checkoff. I do want to overemphasize that if you guys are not successful in your checkoff exams, you will not be successful in lab, and that means you will not be successful in didactic, and you will not be successful in the course. So let me, okay. So you will have a link that you will be able to sign up on Sign Up Genius, which is going to be found in Populi. So it's a really easy link that you can use, and you can just find the availability then. Again, this is going to be outside practice. I know that you guys are going to be busy, but you're going to really need to incorporate this into your schedule. Did you want me to? Okay, so classroom dress code. So all students must wear scrub tops and bottoms to attend both Teams classroom and in-person classes. So your online classes, you need to be in scrubs, and anytime you come on campus, you need to be in scrubs. This also includes anytime you are taking a test. So just put in your head, anytime I go on campus, I am in scrubs. For non-clinical classes, the scrubs can be any color. So you will be removed from either your online virtual class or in-person classes if you are not in correct clothing. Okay, so nursing students attending clinical in a faculty must wear light blue scrubs. So seal blue. If you go to any uniform store and you just say seal blue, they'll know exactly what color you need. All right, so scrubs must be clean and well-fitting. So shoes and socks must always be worn in the clinical setting. Shoes can be all white or all black, and they need to be slip-resistant safety shoes. So no open toes or no Crocs. Okay, they need to have a back to them, especially no sandals, flip-flops. They're not permitted in the clinical setting. So clogs can be worn if they have a closed back. So this must be the same for class, labs. For class and labs, the shoes can be any color, but they must be flat. So really just go with your most comfortable tennis shoes. Appropriate undergarments must be worn and remain non-visible through the uniform at all times. So the student may wear a scrub style lab coat at the same color of the scrubs. So we do give you guys patches that you can put onto your lab coats. So that is obviously permitted, but you need to make sure that you have appropriate undergarments under your uniform. And so I want to add to that last slide too. So we need to make sure our uniforms are clean and ironed. Okay, we can't walk around with wrinkled scrubs. Okay, so we have to look presentable at all times. Okay. So jewelry, we have to keep this jewelry down to a minimum. So you can wear a plain wedding band, but no other rings, bracelets, facial piercings, or visible necklace. Okay, this is also a safety measure, all right, especially when we're in a clinical setting with our patients. This protects us and our patients. So if there is any religious reasons why you need to keep any type of jewelry on, then that's when you will have to come to me and let me know, and then we can talk about it, and then we can approve you for that. All right, hair must be kept off the collar and away from your face. So pretty much just up in a bun, kind of how, how I have mines. Even when I have like long braids down, I still have to keep it up and away from my face. Men, you may wear obviously a mustache and a beard, but it has to be short and well groomed. Okay, and we cannot wear perfume and cologne because this may cause an allergic reaction to our patients. Okay, so this can aggravate any type of asthma, nausea, to not only the patients, but your peers. So no perfume or cologne. All right, full clinical dress code includes obviously your scrubs, your AIAM patch. We'll give you one that's ironed on and one you can sew onto your scrubs, and then your name badge. I tell you guys that you guys have to always have your name badge on you. Just keep it in your car, okay? Because if you don't have your name badge on you, you can't join clinical and you can't join your classes or take a test when you come on campus without your name badge. So ID
Just
badge
at work, you're
policy.
expected to wear it.
What'd you say?
Sorry, just reiterating, just like at work. You need it to get to work.
Yeah.
So we're just practice makes perfect. We're getting in the habit of really doing all of these things consistently.
Think about it like that's how you're going to get paid too. you know, when you start working is your name badge, and you know, that's how you clock in. Okay. So you want to make sure you always have it. So yeah, I pretty much said that. You always have your name badge. You won't be allowed to take your exams. The worst thing that can happen is you come on campus to take your exam, you don't have your name badge, and you can't take it. Okay, so quiz, and you guys can put your answers in the chat. So what color is the scrub uniform for nursing students attending on-site clinical? You could put your answers in the chat.
For some reason, it's not letting me talk in the chat. It's saying because I'm not a member of the chat.
Me either.
Okay.
You will
That's
not
okay.
be graded on this. You
Yeah.
this will not count against you. But Brittany, while we are doing this, what was your question? Since you had your hand raised.
Yeah, I was just trying to make sure that I don't want to like it's deadlines to those like that stuff you need in like our medical documents. I don't
Mhm.
want to miss the deadline, so I'm like, is it like a sheet of paper that you're gonna give us to let us know like okay, you need to do this around this time, so we're on time with it.
Yep.
Okay.
During the first day of the quarter, I'll shoot you guys an email, and it'll have a honey-do list. It'll have the checklist with the due dates on it. Most everything except for 3 things is due the first day of next quarter. So we have time. And they'll talk about it during one of your classes this quarter to show you how to upload it. So that way you may not even need to email back and forth with me if you just upload everything onto there. Good question.
Okay, thank you.
Okay,
All right, true or false? And saying we can put our answers in the chat. You guys did really good with the first question. So yeah, the answer is seal blue uniforms. True or false, short acrylic nails can be worn for lab and or clinical as long as they do not extend beyond the fingertips.
False.
Good.
Yeah.
And that's something that you guys are going to have to get used to. That's something that I had to get used to, is no longer wearing acrylic nails. But when we wear those long acrylic nails, there's nothing but germs up under them. Okay. Same for gel nails. So we just have to have short, clean nails.
okay, so I can do this one. I can take over. So policies related to testing. Okay, so on-campus tests and exams. Okay, you will take your midterm and your finals here on campus. And that's when they're talking about having your ID badge. We have to verify who you are, and we do that by using your ID badge before we let you take the test. Okay, exam dates will be on your course syllabi. Okay, so testing rules, and you will hear these when you come for a test. We have a lot of, out here in our parking lot, we have a clinic as well. We have a massage and acupuncture clinic that runs all the time, and there's spots that are marked for those customers. So do not park in one of those spots so that you do not get towed. Okay, when you're in there for a test, you can't have coats, jackets, sweaters, hoodies, gloves, hats, smartwatches, earbuds, audio devices, or necklaces. So just be prepared. I mean, you can always take off coats, jackets, sweaters, hoodies, gloves. Just be sure to remember that's going to happen. All cell phones and electronic devices must be off and secured by the instructor. We'll either have them at the front or the back of the class, wherever the instructor prefers. And if the phone rings or sounds during testing, your test will end and you will need to meet with administration. You don't want to come meet me face to face for that. So, okay, so book bags, backpacks, purses, pencil cases, food or drugs cannot be at your seat. Food or drinks. Student ID is required to sit for a test. We'll have you put it on your desk, picture with the picture and your name up so we can see it. And if you arrive more than 10 minutes late, you won't be able to sit for the test. Okay. Okay, so in your Great Start class, this isn't one that's, like an extra class you have to pay for. It's kind of a freebie. It's a free class we put you in to teach you about not only academic misconduct, but also about the lab, open lab, and also about clinicals too. Okay, so academic as well as professional integrity is essential in the field of nursing. Academic misconduct will not be tolerated, and the consequences for testing violations are as follows. Okay, and I hope nobody does this. You really, if you study, you don't need to. Okay, so first instance of academic misconduct, you get a 0 in the test. Second instance, you fail the course. Third instance, you get dismissed from the school and you cannot come back. No opportunity for readmission. Okay, duplicating or distributing test questions at any time. When you come in to take a test, a lot of times for your midterm or final, you'll have a scratch sheet of paper. Do not write test questions on there. You can put scribbles, you can put numbers, you can do formulas, but do not write the test questions on there. And if you get caught cheating on one of the final exams, that's exit exams, you fail that course and you get dismissed and you cannot come back to the program. So just remember that. Okay, so what's the dress code for on-campus classes and labs, including test-taking days? All right, this is easier, easy. Scrubs, any color scrubs, okay? Okay, and you can have, like, if it's a little chilly, you're thinking it's gonna be cold, you can wear a long sleeve shirt, but it has to be under the scrub top. Okay, so a lot of your quizzes, well, all your quizzes and exams other than the midterm and the final will be online. We have a little setup that will show you how you have to get your desk set up for testing. And this is it. So you have a separate, like you'll have a camera stand off to the side that has a camera that will take this view of you. And this is what we want to see when you're taking the test. They don't want you chewing gum because if you're chewing gum, you might be talking. You may look like you're chewing gum. You may be talking to somebody, or you may actually be chewing gum, but it looks like you're talking to somebody. So we don't want you to do that. Your phone off. Usually, we prefer to have your phone off away unless you have to log in, but we'll let you keep it there. Laptop screen visible, no earbuds, and we have to be able to see your mouth and face as well as both hands. And you will be reminded of this in every class, I promise you. Okay. So, like I said, in the syllabus or on the Populi course pages, there'll be files that have all the testing rules. As long as you meet all the requirements for testing, meaning you're there, you have your badge, you've done everything you need to do to take the test, you'll be able to take the test. Okay, testing sessions are recorded. That way we can review it if there's any irregularities. And then all academic misconduct policies apply to both on-campus and Teams testing environments. Okay, so educational objectives, outcomes, and expectations. Okay, so outcomes and objectives. We're going to use a holistic nursing approach to provide safe nursing care. And like I said, this is the whole person concept. You look at the biological, psychological, spiritual, sociocultural, and physiological needs. You'll learn to provide nursing interventions that integrate the science or traditional modalities with awareness to holistic caring. And basically, a nursing intervention is what you can do as a nurse to help improve the patient's health based on their condition. And you will demonstrate safe, competent nurturing care in the practice of nursing across the lifespan. Okay. You also promote an environment of respect and harmony by consistent display of professionalism in interactions, communications with clients, peers, and members of the interdisciplinary team. Demonstrate knowledge of computer technology and informational literacy appropriate for the entry-level healthcare professional. And we do have student services here, which will help you get everything set up as we get going. If you have problems, you can always reach out to them. And then another objective is to obtain licensure by meeting requirements set forth by the Ohio Board of Nursing, which includes taking the NCLEX and passing it. And then you're going to account for competence and professional growth. Remember, this is just the first step. Okay, so program completion requirements. Okay, for our program, you have to score an 80% on all your courses. All your nursing courses have to be at least 80%. Okay, you have to meet or exceed attendance requirements. If the required minimum score is not met on the exit exam in 109C, which is that's your final course. That's kind of like your capstone course. The course will not be passed. And the student will be required to repeat the course. Now, this is the one where I talk about where you have to score a 900. Okay, this course, only this course, may be repeated twice for a total of 3 attempts to pass the course. Failing it a third time will result in dismissal without opportunity for readmission. But we're all hoping you pass it on the first time. We have a live review session at the end of the program. It's 2 days, and we have a person who specifically does it. That is her only job, is NCLEX remediation and preparation. So you'll have 2 days of the live review, and that's here on campus. Okay, you have to have all your tuition and financial obligations settled to complete the program. And you have to complete the program within 1.5 times the length of the program. So basically, you're allowed, it's 50.5 credits. So the most number of credits you can take is 75.75 credits while you're taking it. We're hoping you're not going to fail anything and we'll just roll right through. Okay, so expected qualities in nursing. Say professionalism, conduct, aims, or qualities that characterize or mark a profession or professional person. Integrity, the quality of being honest and having strong moral principles. And responsibility, state of being accountable for something, being accountable for your actions, being able to act independently and make the right decision. And then conduct, we want to see respectful professional behavior at all times. You will get that from your instructors. We expect to get it back from you. Disruptive behavior such as talking in class while instructors speaking or fellow learners addressing class will not be tolerated. Violations may result in removal from the class and or program. Now, granted, that type of violation would have to be something pretty extreme. Usually if you're talking and somebody else will just ask you to hold your questions or hold your comments even in class. Okay, in scholastic achievement, while you were in nursing school, it will be the primary focus in your life. I mean, I know everybody has other things going on, and I know when I went to nursing school, I was working full time. It's a lot, but you'll get through it and it'll be rewarding. Okay, homework and assignments must be done on time. Whenever you go into your classes and you look at your syllabus, it will have due dates for all your homework and your assignments. If you do not get them in on time, it's like you didn't do them. So please get those in on time. That will help you get through a class if you're close. Okay, so attendance policy. Every course syllabus has the attendance policies in there, and it's in the school catalog. And students are expected to follow the attendance policy, including absenteeism and late arrival, early departure policies. Okay, and students responsible for information and skills covered in the course, whether absent or not, should contact the instructor on missed information. Remember, Dr. Gould told everybody yesterday, you are responsible for checking your email on a daily basis. I would probably check it twice a day just to make sure nothing has happened. Homework is due on the due date, regardless of absence from the class. And one thing, a lot of people get Outlook, and that way they can check their email that way, or you can use something else that notifies you if there's an email that comes in. Okay, so distance education policy, we kind of talked about this. The online class is to be treated as if you were here on campus. When you're on your class, you can't be driving or riding in a car, you can't be working, can't be shopping, sleeping, laying down, be in a hospital, be in a bed, or any other non-learning educational activities. The idea behind this is we want you to be able to focus on what we're trying to teach you. I mean, this is your program. You're trying to get through this. You want to become a nurse. We want you to become nurses because some of us are getting too old to do it anymore. Okay. And a lot of times students may not be on the AIM campus for online courses. There can be exceptions. Like if you came in here to get something done and if you're running late and your class starts, then we can do a one-time exception. Usually that goes through me if I'm on campus, Dr. Frost, or Dr. Hyatt. Okay, so basically if you're doing a non-learning activity, you get one warning, and if the behavior continues, we remove you from the class. Okay, so if you get removed from the class, first you have to talk to probably me or Dr. Frost, and then you have to make up that time. Because with the state of Ohio, you can only miss like 10% of your total time in your program. You have to make up anything that goes over that. Okay. Let's see, consequences may include behavioral warning or probation, not being allowed to make up missed work or tests. And that's at the discretion of director of nursing for nursing classes or myself. Okay, so textbooks, nearly all of your textbooks, nearly all, will be ebooks, and they'll be available through the Elsevier Evolve platform, which you'll get access to. You'll talk whenever you get into your Great Starts class. You will need to have the Nursing 2024 Drug Handbook. This will be essential whenever you start your clinicals, because when you're on your clinicals, you can't have your cell phone looking up drugs. The expectation is you have a handbook there and you can look them up. And then there's an all-in-one care planning resource. That's kind of like a care plan book that you should have as well. And it does say you have the option to purchase the hard copies of the ebooks out of pocket, but you don't need to. You can just use the
I have a
ebooks.
question.
Okay. Question? No? Okay.
Is this the book you're talking about right here? This one?
I can't see. Is the ISBN? It's by Pamela Swearingen.
Yeah,
I
that
can't-
looks like the correct book.
Okay, I can't read it.
Resource.
Yeah, that looks like the correct book.
Yeah.
Okay.
And it would have that ISBN. If you look on the inside of the cover, it should match that ISBN.
Okay.
Okay. All right. Okay, so tutoring is the key to your success. If you are starting to struggle, I wouldn't even say if you just have doubts and you're not sure of what's going on in the class, you don't quite understand it. First of all, go to your instructor first. Reach out to them individually, send them an email, Teams, whatever. Reach out to them and tell them that you're struggling with some of the concepts. Okay, it's not high school here, and just about everybody will need additional help. I can tell you that when I went through the nursing program, I was in open lab like every day, and we had study groups as well. It's not like regular college, and you'll see that once you get into the program. And be proactive. Don't get behind. We want you to ask for help as soon as possible. And the lady that I talked about earlier, who does our live review classes, that's Eleanor Shaw. She does live review and she does tutoring as well. She will do tutoring before the midterm and before the final. Depending on how you're doing in the class, you may be required to do some amount of tutoring. Okay, like I said, students do not have a passing grade for midterm are required to attend one tutoring session at least 1 week before the exam. And then if you're before the final, you have to attend 2 tutoring sections, at least 2 weeks before the final. Okay, like I said, you can go through your instructor, or you can use Ms. Shaw, and her email address is right there. Okay, if you do not attend the required tutoring sessions, they will receive a 0 on the midterm or final. You will receive a 0. And we do, just a note on this, Ms. Shaw has tutoring sessions morning, day, and evening. She even does them on the weekend at times. She tries to accommodate student schedules, because the idea is we want you to be successful, and you're not going to find many places that actually have a dedicated tutor. Okay. So contact info, all AIAM personnel have email accounts consisting of first initial and last name at aiam.edu. Like Chase said, it's cmains@aiam.edu. Mine is pfrazier@aiam.edu. Okay, you can also email instructors, others from the info tab on Populi. Populi is accessible from anywhere you have an internet connection. Okay, and it's the student's responsibility to have contact information for all instructors each quarter, and that is available on Populi. And it's also in the course syllabus. Okay, student email. You've probably heard about this from Dr. Gould yesterday. Students required to communicate with faculty and staff using their AIAM EDU student email. If you send us something from another email, it's not that we won't respond. We just might tell you to send it to us using your AIAM email. Okay, and emails are sent to students multiple times each day, especially depending on what phase you're in. If you're doing clinicals, you might get more than you want, but there'll be multiple times. So be sure to check your email on a regular basis. Okay, so our learning management system is called Populi. This is where all our exams are based. This is where all our lessons are. You will have to have a cell phone with the authentication app for logging into Populi. You have to authenticate every 90 days, or if you're logging in from a new computer. Okay, nursing coursework is completed in Evolve, because you'll see we have both lessons, videos, and what we call EAQs, which are Elsevier, they're adaptive questioning. Those are kind of like to help you with the NCLEX and to help you in your class as well. And like I said earlier, assignments must be completed by the due date. Okay, so Populi is where you'll find your schedule, your grades, and your attendance record. And you'll also find clinical information in there as well. Your link for Teams class is located in the Populi course page under links. So when you go into Populi, there's a tab on the left-hand side that says syllabus. When you click on that, on the right-hand side, you'll have links for all your classes. Or you'll have a link for that particular class. Okay, so in this program, you have to take time for yourself. You're going to have a lot of responsibility. And I know a lot of you have families, you have kids, you have work, you have all sorts of competing interests. But nursing school is hard, but you'll get through it. You try to get plenty of sleep each night and find time to relax each day, even if it's just 10 minutes to sit down and just breathe and think about what's going on. Take a few deep breaths throughout your day to clear a tired mind and body. And let this time be enjoyable for you. You're doing a great thing for yourself. Okay, questions? Oh, what I would like everybody to do, if you haven't already typed something into the chat, just put your name in there so I can make sure that I get attendance for everybody.
My chat
I'm
is still
sorry.
not working, sir.
Okay, that's
If you
Is that-
already said, are we getting this deck emailed to us?
yes, as long as I have your email, yes.
Okay.
And usually what I
It's
do,
still not
if
letting me write in the chat.
yeah, if you're logged in, like just by your first name or whatever, that's fine. I'll search for you, I'll find your name, and I'll send the email out to you with this presentation on it.
Cheyenne, to answer your question, are all classes Monday through Friday all in person? No, they are not. Your Populi account, when you hop on there and pull up your courses that you have for the quarter, if you pull them up individually on the syllabus page, it'll say if it's virtual, if it's in person, what days it's running. Same thing on your syllabi. You guys will also get Teams invites. The first week, we try to do all classes virtual for you guys' sake. Help with the transition so you're not having to try to come to campus and figure things out. So you shouldn't have any in person on the first week. That is not typical anyway.
Yeah. Well, I can add to that. I mean, your theory classes, other than your midterm and your final, those will all be online. Your lab classes, that's a little bit different. Some lab classes are all on campus, other than probably the first one. And some of them are virtual. We have some that are nothing but virtual. But you'll see that whenever you get into your program. Okay. Any other
I even
questions?
noticed
Go ahead.
that this class that says starts October the 7th. It says first week virtual, rotating on campus and virtual. So we don't got to worry about that this coming up week. So it's in person the following week.
Right. So yeah, first week virtual, rotating on campus and then virtual. So you can also, I always think that the syllabus is a good reference because it outlines when you guys are going to be on virtual and campus too. Also, I'm pretty good along with other instructors, just sending you guys out like a quick text message or email saying, hey, reminder, lab is on class or classes on virtual. Okay, so we try to send those reminders out to you guys as much as we can. But whenever you do have a question, you can just always refer to your syllabus because that's where it's outlined at. I also wanted to tell you guys really quick that as far as the textbooks that you guys need, there is a website. It's called ohiolink.edu, and I'll put it in the chat. And I just looked it up, and they do have the all-in-one book, and same with the drug handbooks. I used to use it all the time in nursing school. It's a really good resource. You can either you go online and request the book. Most of the times they're brand new, and you can either pick it up from your local library or they will mail it to you. Okay, so it's ohiolink.edu. It's a really good resource for you to get any of your books from. And I want to remind you guys too that we do have a library with a lot of books that you can get from the library too, and check those out.
I do have a question. I purchased the all-in-one handbook, but I got it on ebook. So will I be able to use that one on ebook? I know you said the drug handbook, no.
Yeah, they want you to have the all-in-one handbook, like a hard copy, because you take those to clinicals with you.
Okay.
hmm But again, you can get on, if you already bought the ebook, just try to use the ohiolink.edu. I just looked it up. They have multiple books here in the area that you guys can pick it up from.
Yeah, Haley, what's your question?
For the Evolve, I believe I have a login, but I don't have any books on there, so I don't know if that's supposed to look like that or if I'm just supposed to wait or what I'm
Yes,
supposed to do.
yes, because Evolve still needs to get the class list. They'll get the class list finalized. It usually takes about a week to get everything straight in Evolve, because they're kind of a third party. So we tell them what we need and then they do it. We can't really get into their platform that much. Okay, and I have to wear my glasses. Is that Nakia?
Oh, yeah. Oh, sorry.
I was gonna say,
Somebody.
one of our has a chat question. Yeah, Tay's
can
been
just
waiting.
Call me Nikki.
When do they get the name badges, Mr. Fraser? Is that after they meet with Andre, or is it big a class? I
So
don't
you'll
remember
have
which
a
one it
student
is.
support appointment, and that's when they'll do the name badges.
Okay, student support appointment.
Yeah, and just remember
You'll,
if you,
also
sure
in
they-
the student, sorry,
Yeah.
I'm sorry.
Go ahead.
Also in the student support appointment, you'll get a pink slip, because someone just asked in the chat, when will you receive your nursing lab bags? You'll get a pink slip and then you'll bring them to me. So what I'm going to do here in the next couple of days is look at you guys' lab schedule and see what time works best for you to pick up your lab bags sometime next week. Even if you don't have the pink slip and you're not able to get your lab bag within the first week, that's completely fine, because we don't start usually using them until like the second week in. So I will put the times where you guys can get your lab bags. I'll put them in your Populi and I'll send you guys an email.
So just for clarification,
Okay.
we're still waiting, some people are still waiting on Evolve to send that email for us to have access to Evolve.
Correct.
Yes.
And you'll have to have your meeting with student services to get access to.
And great starts is where
Evolve.
you'll get and probably start getting access. I will be working on getting everybody into Evolve as soon as the quarter starts. In fact, I'm already working on it. We'll continue to work on it.
Okay, which platform do we all use to like communicate with each other as like a cohort? Like if we have questions that each other can answer?
Ooh, that's a good question. Sometimes people will utilize Populi under their class. They'll hop on the dashboard. The dashboard anybody can post on. So if you want to add a generalized question for the cohort to see if somebody can answer it for that class. Otherwise, I think students usually just end up kind of making group chats with each other.
Yeah.
Okay.
You make buddies throughout this process, and then you guys make group chats and study groups from there.
Yeah.
Okay.
Just be careful what you put in the in that Populi chat, because everybody can see it.
Yes.
So the badge that we got when we met with Andre, I met with him. And they took my photo and gave it to me like on a necklace thing. So is that the badge you guys talking about, or we got a different one that we received?
No, you got it. You just came in at a time to get it earlier.
Oh, okay.
Okay. Let's see, I don't see any
Lab
more.
bag does not come with scrubs. You'll have to purchase scrubs separately.
Thanks for bringing that up, Chase.
Yes.
And we'll just get the thing, the patch that we'll have to iron on, you said? Or
Yeah,
sew
you'll
it
get
onto our
one.
lab coats.
Yeah, you'll get one iron on and one you can sew on. And if you need, I mean, we have thousands of badges. If you want an extra one for your lab coat, that's fine. You can just come and ask me.
Yeah.
Cool. Thank you.
And those are just for your clinical scrubs. you guys don't have to put the AIM logo on your day-to-day scrubs.
Right.
Day-to-day scrubs are whatever color, casual. I used to wear my Sesame Street scrub top on fun days, and this as long as it scrubs for class, you're good.
Okay, any more?
I believe Haley is our
Yes.
next one.
Yeah,
I do have a quick
I met
question.
with Emily Vore, I believe, and I believe I have everything that you guys are naming off, like the name badge and everything, but I haven't met with Andre. Do I still need to meet with him?
Andre is financial aid. That you would know. He'll let you know if he needs to meet with you.
Okay, thank you.
The
Miss Alita.
Alita.
Just a quick question. So I have a small dermal on the side of my face here that's been there for like, my daughter's 11, so it's been there for like 9.5 years. Do I need to like, I have to go get that surgically removed? Do I need to take that out or can I like cover it? I don't know.
Yeah, you can just cover it. You can either, if you have like those small little dot band-aids, you can
Okay.
just put
Yeah.
one of those on there.
Okay, cool. Thank you.
Mhm.
I have a question now as well. I have a lip ring. So will I have to like wear a mask or put a clear one in or what?
If you could put a clear one in, yeah, because that will save you a lot of hassle just always having to wear a mask or cover it up every time you're on campus or in lab or doing your check off. Versus the clear one, it'll be a lot less easier to see. And then someone asked about just like simple stud earrings, kind of like how like the ones that I have in, just small stud earrings. No nail polish at all. Okay. No acrylic, no gel, no nail polish. I know it's hard for us ladies to do that. Nose piercings has to come out unless it's in there for religious beliefs. Tattoos also have to be covered up, especially during checkoffs. Like, big like neck tattoos. Hand tattoos do not have to be covered up, but neck tattoos or any visible tattoos on your arms will have to be covered up.
Yeah. Okay.
Sorry, ladies.
Okay, any other questions?
Nicole, clear nose rings you can get on Amazon.
But is that acceptable, Kayla, to do a clear nose ring? Like for
Well,
just those little cover?
Yeah, or you could just do like the little dot band-aid cover. You could just do that.
The policy is it's every time on campus. All of this needs done every time on campus.
Yeah. And as far as lashes are concerned, you can't have the big giant lashes. Sorry. Okay. Okay, so if nobody has anything else, if you don't have any more questions, you can log off if you want to. And once I get this recording, I will send it out to everybody.
For the all-in-one book, I found it on Amazon, but is it the 6th edition? Do you know? Because I put in the book number into Amazon and this is what popped up, but it says edition 6.
It is the 6th edition.
Perfect, thank you.
Same for me as well.
You said we won't have to purchase those textbooks. We can just get them from the library.
Well, that's just one of the options is not our library, because they won't let you check this book out. But the website that I put in the chat, ohiolink.edu, there's multiple hard copies at multiple libraries around here that you can pick up that book. And you can have it for the whole quarter.
Okay, good. Okay, thank you.
Yeah. Also, this may seem overwhelming because we just talked about a whole bunch of different things. You guys don't panic. The first 2 weeks are kind of our grace period of the quarter. Our instructors are really good about answering questions. There is no such thing as a dumb question. Ask everything. You cannot over ask. So please, by all means, utilize your resources with reaching out to people. We will have problem solve. We will not leave you high and dry. It'll all be okay.
Are we able to get our TB shots from our employer?
Yes.
Yeah,
Yeah,
as long as
if
it's-
you're working for a healthcare system, but I need documentation that where it was done through, and we have special forms that need filled out from that facility. Just like a paper copy that you'll print out, take with you, and they'll fill that out for us.
Okay. Thank you.
Also, I have that certification you guys said, the BLS, but I don't know if it's still active. Does it have to be active, or I just had to have been and took it before?
It needs to be
has-
active.
Okay.
Yep. Yep. And it's every 2 years that BLS is renewed. And it has to be American Heart Association specific.
Yes.
Most of our clinical
Yeah,
sites won't accept anything different.
Okay.
Yep. Great questions. And again, we have time on those things. It's just the drug screen background check, which both are done at the Arc Point Labs, and then the physical with an advanced practice provider. So whoever is your primary care provider, and that will have its own exam form. I'll be sending out to you guys tomorrow. Print it out, take it with you. They sign off that you're physically eligible and good to go as a nurse. And those are just the 3 things that we need this quarter. The rest is next quarter.
Above all, don't panic. Don't panic. We'll work everything through. We will get everything done for you. Okay, I'm seeing if there's any questions in the chat. Okay, I don't see anything else. I'll send out the student support email whenever I send out the recordings. And it'll have my email address and Chase as well.
One more question, sorry. Are we able to come to campus and like print certain things out that we need or would like printed out?
Usually not, I mean, because our printers are just back here in the administrative area.
And then you did say we had our own forms for the TV shots, right? You guys are going to provide us with the form?
Yes.
Okay.
Yes.
Right.
I will send all of that information out tomorrow with step by step, all the information that we need.
Okay.
If you have any
So
more
every-
questions, I think you're
Yeah,
free to go. Is that right, Mr. Frazier?
Yes, if you don't have any
Oh.
more questions, you can go, you're free to go. And like I said, I'll send out this recording along with my email address and Chase's email address.
Okay.
And
So
Kayla's.
every other Thursday is labs. So does that mean that we'll be in labs starting next Thursday on campus?
It kind of depends on your class, but usually so, yes. Usually when the one-on-one lab, it rotates.
Okay.
Campus and virtual, campus and virtual.
Just
But
make
it'll
sure
be
we're
on the
checking
syllabus.
syllabus.
Yeah.
When you get your syllabus, that's the syllabus is kind of like your Bible.
Okay.
That tells you what's going on, all the rules and policies, a lot of the different stuff is going to be right there in the syllabus.
Okay, gotcha. And one more for Chase. I heard you, but you were kind of cutting in and out. I know it's like your 3rd time explaining that, but you said what 3 papers are due? I know you said if the rest are was
You're
due by
good.
2nd quarter.
So it'll be the physical
Physical.
exam with the advanced practice provider, and then the drug screen background check are actually done at the time at Arc Point Labs. So it's a 2-for-1 deal, and the school pays for it for you guys, which is awesome. And I'll send out info on how to schedule
Oh, how
that.
to,
Yeah,
all right.
yeah,
Perfect.
don't panic. Like I said, we will get everything taken care of. I know there's a lot to think about, and it's a big deal trying to get to school, but
A lot of
we're here
information.
we're trying to help you out.
Awesome.
You guys are
Thank
just
you.
on it. Y'all are super on it. We love that. That's a great nursing personality to have. Okay.
Actually, you won't get
Happy-
your emails usually your email goes to your actual email account, not Populi. There's not really an email within Populi. We can email from Populi, but you won't get your emails in Populi. You can use Outlook or whatever. Like if you use Yahoo, but usually we say Outlook. You get Outlook set up and your school email address will be set up through Outlook.
Mhm. And that's usually covered first day of classes too. Your instructors will show you, this is Populi. This is where you find all your stuff that you need on it. All the important stuff. Yes.
Okay.
And if you feel like you're not tech savvy, by all means, just ask for help
Yeah.
from either other students or your instructors. Because sometimes Outlook and Populi are not super user friendly.
Okay, medical documents. All right, I'm just looking in the chat here to see if there's anything else. Can we see how the book looks? Which book are you talking about?
The all-in-one.
Oh, the all-in-one, okay. That's your time back. Okay. As long as we have your name and we know you attended, you'll be good. I'll send the email out to everybody. Yes, Haley.
My name is not spelled correctly, and I haven't noticed until just now. Is that gonna be like an issue going further?
No, it's not going to be an issue. I'm going to maybe write it down. Okay.
Is that just on Teams or is it in Populi or Outlook or?
Yeah. Is it, how do you, which,
Oh yeah, it is spelled wrong on Outlook. I'm not sure about Populi. I
I'll
can
take,
look.
how's it spelled? And I can,
It
I can look it
my
up.
Yeah, my name is spelled Hayley, so it has 2 Y's.
Hayley. Okay, I'll take a look at that. I'll let you
Okay,
know.
thank you.
All right. All right. Okay, anybody else? Anything else, Chase or Kayla? No. The
No.
link for the
The link
link
for
for the
Alpha.
books.
I
Oh,
put it in, I already put it in the chat, but I'll write it again here. So I'll have link.edu.
What I get credit for
Oh,
yesterday's orientation, I had to leave like at a little before 11 so I can make it to my appointment to pick my laptop up at 11 yesterday, but I was in on time. Yesterday's orientation.
yeah, okay. Well, I mean, did Dr. Gould have your name? Did he know you were there?
Well, yeah, I
If-
put my name. My name was already posted there, not in the
And they
chat,
could-
but
Yeah.
I've been there since 9 a.m. So, but I
Yeah.
did let them know I had to leave like at 10:30 before 11 so I can make my appointment to get my laptop.
Okay, but you were there for part of it. Okay.
Correct.
All right.
Yeah.
Okay, you should be good.
Okay. Thank you.
I wrote your name down. I'll check.
Will do.
Okay. All right. So I think that wraps it up for everybody. If there's no other questions. And when I send the email out, like I said, I'll have my email address in there, Chase and Kayla's. If you have any questions, please feel free to email us.
we will see you all soon.